Hi doctors, in this video I will talk about the correction of a class 2 division 2 malocclusion with deep overbite and severe crowding. My patient was symmetric with labial competence and had a low smile, a steep curve of span, a negative torque of lateral segments and spaces between lower incisors, canines and first left premolar. X-rays analyzed reveals an hypodivergent skeletal pattern, retroclined upper incisors, a normal lower incisor angle accordingly with periodontal biotap, a normal overjet, an increased overbite and high wisdom teeth in the upper arch, so they don't need to be removed. I planned only one set of aligners to fix this case and total treatment time was 15 months. So what about the requirements for the technician? In the upper arch, make expansion until the teeth axis become perpendicular to the bone. Remember to make upper distalization, first molar distal rotation and expansion simultaneously. The possibility of multiple movements at the same time makes them more predictable and speaks to one of the benefits of aligners, their efficiency. Start anterior intrusion after anterior proclination in order to avoid root contact with the cortical bone before intruding. Please don't forget to give lingual root torque to upper incisors so that their retrusion could be a bodily movement, and to overtreat anterior intrusion and anterior proclination. In the lower arch, we must obtain an anterior intrusion adding a reciprocal posterior extrusion in hypodivergent patients. In this case, in order to level the curve of span, we can apply an absolute anterior intrusion at the beginning of the treatment because we have spaces between incisors and canines. After that, we should retrude lower incisors, adding lingual root torque simultaneously. We have to level also the curve of Wilson, giving backer crown torque to lower molars. This movement flattens the curve of Wilson and create a resultant extrusion that will contribute to the back correction. Finally, it's better to finish the case with heavy posterior occlusal contacts. Now, what about attachment design? We need support attachments on upper laterals and on lower premolars to provide anchorage for anterior intrusion. I also advise you to apply bite ramps on the palatal surface of upper canines to avoid bite block effect and help the posterior extrusion, and button cutout on first molar to assist the posterior extrusion during the correction of second-class relationship. Look at these after images. He had a smile arc improvement and a mandibular advancement. His raised superimposition shows proclination of upper incisors, which was desirable in this case, both to fix the crowding as well as to achieve a relative intrusion. Intraoral final records show that crowding was solved by upper expansion and distalization. Second-class relationship was solved by upper distalization and mandibular advancement, and deep bite was solved by anterior intrusion and reciprocal posterior extrusion. Finally, this is before-after comparison. I was very satisfied with the result because I achieved both a profile improvement and deep bite resolution. For other useful tips, join us on Smart Aligner Service.